3, 2, 1, blast off. It's time for open enrollment. This presentation is designed for benefits administrators to help them prepare for the annual open enrollment period. Open enrollment is October 1st through the 31st, 2022. However, EBS and MyBenefits will allow open enrollment transactions beginning September 15th. As you review this presentation, keep in mind that all information included is for the 2023 plan year, which is effective January 1st, 2023. Let's get started. Here's what's new for 2023. There will be an 18.1% employer-only rate increase for the state health plan. There will also be a small decrease in optional life and dependent life spouse premiums, as well as a small increase in SLTD premiums. You will notice these changes on the January 2023 bill that will be available in December 2022. Co-payments, deductibles, and coinsurance will also increase in 2023, and adult well visit coverage will expand to allow all state health plan primary members to have a well visit each year at no member cost. We'll talk more about these changes later. Let's take a closer look at the 2023 monthly premiums. You can find the premiums at peba.sc.gov/monthly premiums. As a reminder, there will be an 18.1 employer-only rate increase for the state health plan. Employee premiums will not change. As mentioned earlier, optional life, dependent life spouse, and SLTD premiums will change. Optional employers, those whose health insurance rates are subject to an annual experience rating, should also apply the experience-rated load factor. The load factor should be applied to both the employer and employee shares of the health premiums beginning January 1st, 2023. Be sure to use the monthly premium worksheet for optional employers to communicate your premiums with employees, as they may differ from premiums listed in PEBA's materials. PEBA mailed load factor letters to optional employers in March of 2022. You may contact PEBA's customer service for a copy of your letter if you need it. Deductibles and coinsurance will increase in 2023. The standard plan deductible will increase from $490 to $515, and the coinsurance maximum will increase to $3,000. For office visits, members will pay a $15 copayment instead of $14. The generic prescription drug copayment will increase from $9 to $13. The new patient cost share information is available in the health plan comparison chart in the 2023 insurance summary and the insurance benefits guide. Beginning in January 2023, state health plan primary members will be eligible for one well visit each year at no member cost. The benefit is available to all non-Medicare primary adults ages 19 and older who are covered by the standard plan or the savings plan. As in previous years, only evidence-supported services based on the U.S. Preventive Services Task Force A and B recommendations are included as part of an adult well visit. Members can take advantage of this benefit at a network provider specializing in general practice, family practice, pediatrics, internal medicine, gerontology, and obstetrics and gynecology. Remember that eligible female members may use their well visit at their gynecologist or their primary care physician, but not both. During open enrollment, eligible subscribers may change their coverage for the following year. Any changes made during open enrollment will take effect January 1st, 2023. Employees who are satisfied with their coverage do not need to do anything. Their coverage will continue in 2023. Keep in mind, though, employees who wish to contribute funds in 2023 must re-enroll in medical spending and dependent care spending accounts. Encourage your employees to log into MyBenefits to review their current coverage and make selections for 2023. For employees who request life insurance elections that require medical evidence, refer to the Electronic Life Insurance Statement of Health Process resource for details. All other open enrollment changes can be made through MyBenefits. Employees can make these changes during open enrollment. Employees can also enroll in or drop coverage for any eligible dependents. Remember that employees cannot change their dental coverage this year during open enrollment. Encourage your employees to review what changes they can make during open enrollment and plan their coverage before logging into MyBenefits to make coverage selections. Be sure to remind them that any changes made during open enrollment will be effective January 1st, 2023. Also, keep in mind that employees can make the following changes anytime throughout the year. Certify a change in tobacco or e-cigarette use, add or increase dependent life spouse coverage with medical evidence, drop or decrease dependent life spouse coverage, add or drop dependent life child coverage, apply for or change the benefit waiting period for SLTD coverage, which may require medical evidence, and enroll in, change the election amount of, or stop contributions to an HSA. Now let's look at PBA's publications for the plan year 2023. The insurance summary will be available online before open enrollment. PBA will not print and distribute the summary. PBA will print the Benefits Advantage and mail it to retirees, COBRA subscribers, survivors, and former spouses in advance of open enrollment. It will also be available online before open enrollment. The Insurance Benefits Guide will be available online before open enrollment too, but printed copies will not be available. Federal laws require written notification of many notices prior to open enrollment, and send-in notices electronically does not comply with these federal laws. To assist employers with this requirement, PBA will print the required notices for delivery to employers. Notices will be delivered August 22nd through September 9th. The notices will also include a printed open enrollment checklist that employees can use to plan their 2023 coverage changes. You must provide a printed copy of the notices to your insurance-eligible employees by October 1st, 2022. Your hub for everything open enrollment is the Employer Resources webpage at pba.sc.gov/OE-employers. There you'll find links to 2023 publications and premiums, the monthly premium worksheet for optional employers, the open enrollment worksheets, helpful navigating your benefits flyers, and a marketing toolkit with ready-to-go materials that you can use to promote open enrollment. As administrator, you play an important role during open enrollment. Let's take a look at your responsibilities as an employer. Take time to review other insurance products that you may offer. Remember that you may not offer an insurance benefit that is provided through PBA. You may offer products not available through PBA. However, premiums for those products may not be paid pre-tax through Money Plus. Open enrollment is also the time for benefits administrators to evaluate part-time, seasonal, and variable hour employees. During October of the standard measurement period, you should identify eligible individuals and offer benefits. These employees may enroll during the annual open enrollment period for coverage effective January 1st. More information about this process is in the Active Subscribers chapter of the Benefits Administrator Manual. Newly eligible ongoing employees may enroll in these benefits for coverage effective January 1st, 2023. Another responsibility you have is to distribute hard copies of federally mandated notices to insurance-eligible employees. Be sure to also provide employees with the link to PBA's open enrollment webpage, pba.sc.gov/OE. That webpage will provide all the information they need in one place. Encourage your employees to use MyBenefits to review their current coverage and life insurance beneficiaries, even if they don't plan to make changes. Employees should also use MyBenefits to make open enrollment changes and upload supporting documentation. If needed, prepare and issue the COBRA initial notice. During open enrollment, be sure you also review the EBS console daily to approve transactions. Keep in mind that the deadline to approve open enrollment transactions is December 1st. You should document all changes for appropriate record keeping. During the first week of December, PBA will post report HIS 759 in EBS. This enrollment report lists any open enrollment transactions that have not been approved. PEBA will purge outstanding transactions on December 13th, 2022. Finally, you should confirm that the January 2023 payroll deductions correspond with approved open enrollment transactions and advise employees to review their payroll deductions in January. Employers must review and update salary information for SLTD subscribers during open enrollment. This is not applicable to Comptroller General agencies. If salary information is not updated, premiums and any benefits paid will be based on the last salary information submitted to PEBA. You should submit salaries as of October 1st in EBS. You may submit updates between September 15th and October 31st. Once you confirm the updated salary in EBS, you will not be able to make changes. For more information, view the SLTD Salary Updates resource document at peba.sc.gov/insurance-training. Before we wrap it up, let's review a few important reminders from Mission Control. Open enrollment begins October 1st and ends October 31st at 11:59 p.m. EBS and MyBenefits will open for transactions on September 15th. Once the deadline has passed, employees must wait until either the next open enrollment period or a special eligibility situation to make changes. Encourage employees to use MyBenefits to make coverage selections during open enrollment. Current 2022 medical spending account and limited use MSA participants can carry over $570 of unused funds into the 2023 plan year. Remind employees to consider this when making their 2023 elections. If you have any questions about open enrollment, reach out to our Employer Services Department at employerservices@peba.sc.gov.